Good afternoon. I call this meeting of the Human Services Policy Committee to order. Members, please take your seats. I will note that we do have a quorum available. We do have as our first item on the agenda is approval of the minutes from February 20th. Do I have a motion to approve the minutes? Representative Engen.
So moved, Mr. Chair.
Representative Engen moves the minutes from February 20th, 2023. Any questions or amendments? Hearing none, all in favor of the motion to approve the minutes from February 20th signify by saying aye.
Aye.
Opposed? Motion carries and the minutes from February 20th, 2023 are approved. Members, we have a full agenda day with 6 bills. Before we begin, I want to announce to members and the public that we will be meeting at our normally scheduled time on Wednesday, March 1st, as well as a second meeting at 6 p.m. on Wednesday. Because of the fact that we lost a meeting time last week, so that's when our next meeting time will be on Wednesday to help make up for that. If you have questions, please let Committee Administrator Stumo Langer know. And the first bill we have today is House File 1627. We first heard this. This was originally a bill that we heard on March 30th. At that time, it had not been introduced, but the department had been here to make a presentation at that point.
I don't think you mean March 30th.
Did I say March? Sure. I meant thank you, Representative Keel. I appreciate that. I'm going way out there. Thank you.
No, that's
Monday.
I understand.
No.
Just
Yeah.
want to make sure the record doesn't question it later.
Thank you for catching that. I appreciate it. So we have before us Representative Edelson. Representative Edelson, would you like to move your bill?
Yes, Mr. Chair, I would like to, and I have an A1 amendment. The amendment deletes the section of the bill that's relating to tax subtraction, which was determined to potentially have a fiscal impact.
Okay. So first of all, I need you to move your House File 1627.
Yes, thank you. I move that.
Okay. So Representative Edelson moves House File 1627 to be placed on the General Register. I see we also have an A1's author amendment, which Representative Edelson did explain. Are there any questions on the A1 amendment? Hearing none, all in favor of the A1 amendment signify by saying aye.
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 Opposed? Motion carries and the A1 amendment is approved. Representative Edelson, if you'd like to explain your House File 1627 as amended.
Thank you, Mr. Chair and members. And before I do that, it's someone's birthday today, and I have to say that I would be remiss to not say happy birthday to Director Grom right next to me.
Happy birthday, Director Grom.
I think somebody needs to get a birthday cake. We'll do that tomorrow. So this is the DHS bill.
I think it's upon the bill author to bring the cake tomorrow. So
Chair Nor, that is correct. I was wondering the same
chocolate?
thing.
Chocolate cake for everybody tomorrow.
All right, thank you. Representative Edelson, go ahead.
I'm Edina, so I'm familiar with cake. All right, so
Only you can make that.
Right, I know.
We must have had a break.
Yeah, we sure did, Representative Keel. Representative Edelson, go ahead.
I mean,
the
I'm
representative from Edina.
I know, I'm subtracting my time here. Okay, all right. So, Mr. Chair, this is a DHS bill that received the informational hearing as you spoke. And then, I'm going to let, since it's her birthday, Director Grom just take over from here.
Thank you, Representative Edelson. Director Grom, go ahead, please.
Mr. Chair, members, for the record, Christy Grom with the Department of Human Services. So, like you mentioned, this is a bill that had an informational hearing on. We won't go into the full detail in each section of the bill, but I'm definitely happy to answer questions. So this bill is really two-part. The bulk of the bill includes changes related to the direct access reform, which is something that was fully implemented last July, so July of 2022. So it's sections, I believe, 1 through 44, 46, and 47. So there's only one other section aside from that direct access. So that's most of what you see in here is the direct access reform. So this is really just clarifying statute to align with our federal authorities and to align with current practice. So direct access, just a bit of background, is a reform that's been happening really dating back over the past decade, all the way back to 2006 when there was an Office of Legislative Auditor report that indicated that we needed to do a better job in making sure people had access to treatment, and it was related to how we administer treatment through our placing authorities, through our local agency placing authorities, so counties and tribes. People used to have to go and get a Rule 25 assessment, and then the county and tribe would say, this is what you're eligible for, and this is where you're going to go to treatment. So it wasn't just the Office of Legislative Auditor. SAMHSA indicated this as an issue, and then the Centers for Medicare and Medicaid Services also indicated that they were not interested in renewing one of the waivers that we had that allowed us to restrict access or choice of provider to people on fee-for-service medical assistance. And they said, you really need to expand access and make this reform. And so we've been doing that over the past few years. We had a parallel process in place where people were able to go and get the old kind of process and Rule 25 assessment. And then, like I mentioned, as of last July, now people are able to just access the full comprehensive assessment. So it's been fully implemented, and we just need to make sure that we're aligning statute with federal requirements and what we do so that expectations are clear for all. So most of this bill is updating cross-references and removing rules that have been repealed or will be repealed, known as Rule 24 and Rule 25. And then there's some changes around making terminology changes so we aren't referencing placing authorities, for example, because we don't have them anymore. So happy to answer any questions on that kind of very detailed aspect of the bill. And then the second aspect of the bill is related to the Home and Community-Based Services Workforce Development Grant. And so this is a grant that was passed by the 2021 legislature, and it was funded through revenues that we had in 2021 that were part of the HCBS Enhanced FMAP, or Federal Medical Assistance Percentage, which is really just a fancy way of referring to the federal percentage or the federal share that pays for our Medicaid or medical assistance services. And because of that enhanced or expanded revenue, the state had access to. The legislature really wanted to make some decisions about how we can reinvest that funding to strengthen and innovate in our HCBS service space. And so one of the grants they passed was this workforce development grant. 90% of the grant goes directly to workers themselves to help recruit and retain. And there was a requirement that the legislature said, DHS, we're doing this in a little bit of a rush here because we got some federal guidance late. So we want you to make sure 90% of this funding goes to people who actually provide these services and that are making either 200% of the federal poverty guidelines or less. And we want you to go and work with stakeholders on how you're going to implement this. And so in your packets or online, you'll see there's a legislative report that really outlines the contours of how we are using these funds to support our direct support professionals in HCBS settings, which of course are very important settings we've talked about a lot in this committee this year. One of the things that we overlooked when we passed that language was we really don't believe it was the intent of the legislature to impact people's cash assistance benefits. So because people are at 200% of the FPG or less, there's a chance that they could be eligible for things like child care assistance or our medical assistance programs. And so we really want to make sure that they get the full stipend without having to be punished and potentially bumped off of their public assistance benefits. And so there's language in the bill that does that. And then there's also language to expand eligibility to 300% FPG just to make sure that we're able to expend that full appropriation as was intended by the legislature. And lastly, I'll just say these are packaged together in this bill because they are it is important, and we hope that the legislature will support passing these provisions early. Direct access was part of our bill last year, and it's already been implemented. So we really just need to make sure, for federal conformity's sake and clarity, that those statutes get updated. And on the HCBS Workforce Development Grant, we have not disseminated those funds yet to people who are really counting on them and need them because we don't want to implicate their benefits. We don't believe that was the intent. And so that's why these are packaged together, and would just ask for your support and hopefully passing these early.
Thank you, Director Grom. Before we go to questions, are there any other testifiers from the public? Seeing none, I will go to members' comments or questions. Members, any comments or questions? Chair Noor.
Thank you, Mr. Chair. The quick question is the income tax subtraction that we just removed from the bill. Mm-hmm. Will there be a follow-up bill so that we can have that included in a tax bill?
Director Grom.
Mr. Chair, Chair Noor, yes, we are hoping that there will be a follow-up bill, and maybe we could just add that into the Health and Human Services bill, if that would be okay. It was heard in the tax committee already, and so it's been vetted by this body, and if appropriate, we can just add it to the HHS bill to make sure that we aren't penalizing people at that low income.
Chair Noor.
No, thank you, Mr. Chair. Appreciate it, Director Graham. Thanks.
Very good, thank you. Any other comments or questions? Hearing none, I will go to Representative Edelson for closing comments and then to renew your motion.
Thank you, Mr. Chair, and again, happy birthday to the director. And I renew my motion to move House File 1627 as amended to the General Register.
All in favor of referring House File 1627 as amended to be placed on the General Register signify by saying aye. Aye. Opposed? Aye. All right, motion is approved. House File 1627 is being re-referred to the General Register. Our next order of business will be to consider House File 1827 from Vice Chair Frederick. If you'd like to come down to the table and introduce your bill. And this was also one that we first heard back in February on February 1st, and I think I got my month right this time. And this was one of those that was an informational hearing when it first came to us, and so we are now back. Vice Chair Frederick, would you like to move your bill, please?
Thank you, Mr. Chair. I move to refer House File 1821 to the General Register.
Okay, very good. Thank you, Vice Chair. And I also understand that you have a presenter here. Would you like to explain your bill, or would you like to have your presenter?
I can do the introduction, Mr. Chair.
Very good. Vice Chair Frederick, go ahead.
Thank you, Mr. Chair. Back in 2019, the Minnesota Legislature provided funding to support the development of assisted living report card, which included a resident and family surveys and a report card website. This bill kind of updates that. It does two different things to support the department's responsibilities for the report card project. The first would allow DHS to gather aggregate facility level demographic data for the assisted living report card. The second update requires licensed assisted living facilities to participate in resident experience surveys and family surveys when requested by the commissioner. These provisions are necessary to ensure all consumers across the state will have the best information they need through a future report card website to make the best choice possible for their needs and circumstances, in addition to improving statewide data to inform analysis with respect to equity in assisted living settings.
Very good. And with that, I will go to your testifier, Dr. Stockert. If you'd like to introduce yourself, who you're with, and begin your testimony, please.
Thank you so much, Chair Fisher. My name is Nicole Stockert, and I am with the Department of Human Services. And I just want to thank the committee again for listening to our bill and allowing me to testify again on House File 1821. And thank you to Representative Frederick for authoring this bill. So I know that Representative sort of briefly touched on this, but this is really just going back to sort of assist the department in their obligations in developing the assisted living report card, which includes includes resident and family surveys and a report card website. So this is something that the legislature passed and funded back in 2019. And this bill is really just necessary for the department to fulfill our obligations, and it helps us in two ways. So the first one is we don't currently really know who's being served by these assisted living providers, and thus the quality of their services from an equity perspective. So this current gap is prohibiting statewide analysis and research. And knowing some basic demographic information about who is served will help us answer critical questions regarding equity and possible disparities in these settings. This policy recommendation is also in line with recent guidance from the Centers for Medicare and Medicaid Services that advise states to collect and oversample data by demographic categories such as race and ethnicity in consumer surveys to better understand and monitor people's experiences in home and community-based services. And the second change would just allow us essentially to ensure participation with these surveys. So you may remember from mentioning this last time, this is really aligning with the requirements that are already in place with our long-standing nursing facility report card requirements. And I also just wanted to mention that the department has heard lots of concerns from the assisted living report card project stakeholder group. And that's really what's been driving us bringing these changes. This includes members from an external stakeholder advisory group. They've raised concern about broad participation from assisted living providers, and that without that, the state will not be able to provide enough information on the assisted living quality to meet the needs of consumers. I did send out some additional information to members of the committee on this to kind of provide you a little bit more background. So just wanted to point that out, that it's buried in your email from last night. And just in summary, these provisions are needed to ensure all consumers across the state have the best information they need should they ever need assisted living services. And it will help us improve our statewide data and inform with analysis with respect to equity in assisted living settings.
Very good. Representative Keel.
Thank you, Mr. Chair. While I know that the survey is helpful to people looking for assisted living, I'm wondering what it's going to cost the assisted living to provide all that surveys data when they are lacking staff anyway. And I'm really mixed about this. I'll say I don't think it's a bad thing. However, a lot of things are expected of assisted livings. And when I talk to senior citizens that choose to live in an assisted living, they make those choices on services because there's a mix of services in an assisted living. So, and in rural Minnesota, there isn't much of a choice. It is what is ever provided. And I understand why we're doing this, but I'm wondering what the cost is going to be to these facilities when they're already drowning and not being able to keep up with the care they need to give.
Vice Chair Frederick.
Thank you, Mr. Chair. Thank you, Representative Keel, for the question. I want to clarify that the bill itself isn't expanding the amount of surveys going to the consumers there. It is saying that it's giving the department the ability to take that survey data, and then what it was requiring is aggregate de-identified demographic data of those facilities. And so that way the department can say, hey, we have these 5, 10, 50, however many survey responses coming back. We can see who's filling that out, compare that to the overall residents of the facility to see if the people responding in the surveys are representative of that whole facility, and that way, and then that can be posted on the website for people to make more informed choices. So it's not increasing the amount of surveys requiring more work from like the people providing care in that regard. It's just looking for the facilities to provide that information to that de-identified information to DHS.
Okay, thank you.
Representative Keel. Okay. Any other questions? Not hearing any. And I just have to make sure, was there anyone from the public who wanted to testify on the bill? Not seeing any. I appreciate the questions that we've had. Vice Chair Frederick, would you like to offer any closing comments and renew your motion?
No, I hope to have the committee support, and I would renew my motion to refer House File 1821 to the General Register.
All those in favor of placing House File 1821 on the General Register signify by saying aye. Aye. Those opposed say nay. The motion prevails and House File 1821 is placed on the General Register. Our next bill is House File 1683 from Representative Bierman. Since Representative Bierman is not a member of our committee, I will move to refer House File 1683 to the Human Services Finance Committee. Representative Bierman, welcome to our committee. I understand that you have an author's amendment.
I do. Thank you, Mr. Chair.
Okay. Would you like to explain what your author's amendment does?
Yes, please. Mr. Chair, committee members, the author's amendment is in regards to some advice from DHS. We've been working with the department since last fall on this bill, but as advice comes in, we are aligning it. This particular amendment refers to DHS advice on PRTF rate strategies. PRTF is the psychiatric residential treatment facilities. And it also includes PRTF in language allowing for future cost projections and provides clarification on CMS allowed PRTF staffing and capital use. So that's all the amendment does. Just want to add there is no fiscal note yet that we are aware of this on this bill, and we can discuss that amendment if you like.
All right, I will move the A1 amendment. Are there any questions for the for Representative Bierman on the A1 amendment? Hearing none, all in favor of accepting the A1 amendment signify by saying aye. Aye. Opposed? Motion carries and the A1 amendment is approved. Now that we have the bill in the shape the author would like, Representative Bierman, would you like to explain your bill? And then we can go to testifiers.
Thank
your
you.
bill as amended.
Thank you, Mr. Chair. Thank you, members, for the time today. I think we are all aware of the tremendous need for more mental health facilities, and we need to do a lot of work in this area. But this bill is one of a collection of bills being brought forward this session by the Mental Health Legislative Network. That is a network of over 80 organizations advocating for mental health needs in our state. The bill is focused on concrete steps the legislature can take to increase access to intensive mental health services for adults and children in Minnesota. Currently, providers are unable to meet the community need for intensive mental health services. This has resulted in children and adults having to access hospital-level care as the only viable option for many of them. This trend is overwhelming our hospitals, financially straining our state, and most importantly, is not the appropriate treatment model for our community members in need of intensive mental health services. Proposals in this bill respond to these challenges by adjusting current policy to enhance provider capacity to staff key services, including allowance for estimated staffing costs and investments, as well as capital improvement costs to cost-based rates. Coverage of room and board costs for residential mental health services to Minnesota Care enrollees. Establishment of a single streamlined rate structure for behavioral health homes, and establishment of an annual inflation adjuster for children's intensive mental health services. I would like to thank Chair Fisher and Lead Keel for signing on to this bill, and I will now turn to a couple testifiers to outline what the problem this bill is aiming to solve is. Thank you, Mr. Chair.
Very good. Thank you, Representative Bierman. Welcome to the committee. If you'd like to introduce yourself and who you're with and begin your testimony, please.
Yes, my name is Julie Bloom. I am the CEO of Guild Services. We provide mental health services and housing services to adults and young adults with serious mental illness and people who are experiencing chronic and long-term homelessness. Thanks for the opportunity to testify today in strong support of House File 1683, aimed at addressing specific barriers that providers, organizations like mine face in increasing access to intensive mental health services. This bill is narrowly targeted on services that operate with cost-based or state-set rates that are structurally challenged to keep pace with service demands, inflationary pressures, and facility improvement needs. These services include psychiatric residential treatment facilities, assertive community treatment, intensive residential treatment services, residential crisis services, and behavioral health homes. My organization provides all but one of those services, and I want to talk specifically about the adult intensive mental health rehabilitative services addressed in the bill. Each year, providers go through a rate-setting process with the state, which is intended to ensure that our services break even. The rate-setting methodology takes an 18-month retrospective of our actual costs, which is problematic on many levels because costs are increasing every year and it's taking longer to fill vacant positions. For an example, if in the last 18 months I had turnover in a nursing position that took 6 months to fill, it appears that my costs are much lower than they will be in the future. This is the same with cost of living increases and the other pressures that you mentioned. This, combined with the lack of room and board coverage by our state's Minnesota Care health insurance program, inconsistent coverage and reimbursement rates from private health plans, it results in revenues that are simply far below the cost of providing care. And we are struggling greatly to expand capacity at a time when service needs have never been higher. Guild has a much larger budget than many nonprofits that are much smaller, especially those who are seeking to care for culturally specific groups or groups of people that are not as large as our general population. And these rate methodologies take about 3 years to actually break even when you're looking at the changes in rates by that 18-month look back. As Representative Bierman noted, this lack of service capacity is resulting in individuals having to turn to more expensive and currently overstressed hospital-based services. Additionally, people, because IRTs and these intensive treatment services are a step down, so the need that someone has is not at the level of hospitalization. When we turn people away, people get worse in order to be able to access those other services. This proposal before you today presents narrowly focused, concrete steps the legislature can take to address these specific barriers. Thank you for your time, and I'm happy to answer any questions.
Thank you, Ms. Blum. And then next I have Michelle Murray. If you'd like to come down, introduce yourself, and begin your testimony, please. Welcome to the committee.
Thank you. Thank
You're
you for
welcome.
all of your time and your service. So good afternoon, and thank you, Chair Fisherman. I am Dr. Michelle Murray, and I am the CEO president of Nexus Family Healing, and we do an array of mental and behavioral health services for children and their families here in Minnesota. And that includes residential treatment facilities, in-home services, crisis services, youth services for shelter, and as well as outpatient types of therapy and behavioral health. And I'm here also to echo some of the statements here. We support everything that's in this bill, and it's much needed and necessary for both adult and children mental health services. But I want to focus specifically on the aspects of the PRTF. We have, due to all of your actual legislative leadership, back in 2018, you all brought in PRTFs into the state, which was a much needed focus and need, and that has been great. And now we again need to turn to you to continue your leadership, to just pay attention to a couple of the amendments in this bill and to move that forward so that we can keep PRTFs in this state due to some of the hardships, so that we have children, like I'd like to tell a story about Tony, who was a child who was adopted at a very young age, went through a lot of trauma before she was adopted, in utero drug use, neglect, and not having her medical needs met. And throughout her childhood, a lot of behavioral mental health issues, kicking, punching, hurting family pets, biting, not able to maintain school, daycare, and so forth. Parents struggled to get the help that they needed. As Tony aged, behavior got worse. At around age 13, what often happens in this case is the parents didn't have anywhere else to turn. Tony continued to be hospitalized in inpatient psychiatrics. And what happened is, because her behavior was so challenging and difficult, she remained in those inpatient hospitals. And what we call boarding, right, where she stays there, where she's not really getting what the hospital needs to give her, and because she has nowhere else to go. And her behavior was such that the typical residential facilities were not able to manage her due to that different level of treatment. And PRTF was exactly the level of treatment that she needed. And once PRTF came into the state, and I should say too that her parents got to the point where they could not take her back, and they actually gave up custody because they could not have her in the home. Well, once PRTF came into the state, Tony was able to get in, and she thrived. All the hospitalizations stopped on inpatient. It was exactly the care she needed. And it even got to the point where her parents were able to re-engage with her in a healthy environment and work with Tony and continue custody to resume, and contact with Tony, and to work in family therapy on her issues. And now she remains successful in the community because of that. So my ask is that we do the simple things that we need to do to amend some of these issues to keep PRTF here because of the cost. And what the bill is doing is making adjustments to the rate setting tool that will help us project future staffing costs, rises in costs and expenses, and the expenses in our capital to keep up with those expenses so that we can continue to operate them. It also includes policy clarifications on our overnight staffing to keep some quality issues going on there, but also being having the right needs at the right time for that, and shared site opportunities, which would allow some innovation and some more specific needs being met that are supported by the federal government. So though they're minor in nature, they're huge to keeping PRTFs going so that we can offer this to the right child, the right family at the right time, and for the right for the right amount of time. So thank you very much.
You're welcome. Thank you. At this point, I'll check, is there anyone else from the audience, from the public, that would like to testify on this bill? Hearing none, I will go to members' questions and comments. I have Representative Finke first, and then Representative Edelson. Representative Finke, if you'd like to go ahead.
Thank you, Chair Fisher and Representative Bierman. I just want to make sure I'm understanding the bill correctly, based on some of the testimony, but on also my review of the bill. So I think it's not doing this, but I just want to ask, is it changing who the population of the PRTF community, people who are living in these spaces, is it changing anything about who that is, or is it just increasing the rates and making available those services to more of the individuals that need them?
Representative Bierman.
Mr. Chair and Representative Finke, it is not changing the population so much. It's making sure that the delivery model is compensating the people who are doing the work and making sure that people can access it.
Representative Finke.
Thank you, Chair, and thank you. And I'm glad to hear that. And it makes me a little nervous when we start talking about mental health patients and not being in the hospital and having that go somewhere and not getting lost in the system, and making sure that the appropriate care is being offered at the appropriate space. So I just want to make sure that I have that clear. Thank you.
Thank you. Representative Edelson.
Thank you, Mr. Chair, and thank you, Representative Bierman. I do have a question, and I'm wondering if Ms. Bloom or Ms. Murray, one of them, want to come back up. So when right now, if you could just tell me, I'm very supportive of this bill. Let's just start off. I'm not doing. It's a good question. I just want to know what's happening currently in the dynamic in Minnesota. So when we say right now that Minnesota residents, if they need room and board and they have Minnesota Care, tell me what is happening now, because I know we're saying they must be covered for residential facilities, but tell me, like, what does the current look like?
Ms. Bloom.
Thank you, Chair. Representative Edelson. Currently, we just take whatever we can for room and board. So what that looks like is, so we get a set rate based on funds set aside in the for substance use disorder treatment, and then that pays the room and board, which is currently set at about $50 a day. So a lot of private insurance and Minnesota Care don't pay that, and so we just simply don't recoup those costs.
Representative Edelson.
Mr. Chair, is it Miss
Bloom?
Bloom,
Yep.
thank you. Great name, by the way. So with private insurance, this is not, you're not dealing with that all in this. You
Ms.
really
Bloom.
can't, because that would have to be a federal, right? Is that correct?
Yes, that is correct.
Okay. All right. Well,
Representative Edelson.
thank you, Mr. Chair. I'm very supportive. I just wanted clarification on what that looked like. Thank you.
All right. Are there any further questions? Hearing not, I will renew. Representative Bierman, would you like to offer closing comments?
Thank you, Mr. Chair. Thank you, members. Just want to implore you to vote for the bill. We need your support. We have a lot of work to do to increase and improve our mental health capacity here in Minnesota. Thank you.
Thank you, Representative Bierman. I renew my motion that House File 1683, as amended, be re-referred to the Human Services Finance Committee. All those in favor signify by saying aye. Opposed, say nay. The motion prevails, and House File 1683, as amended, is re-referred to the Human Service Finance Committee. Thank you, Representative Bierman. Our next item of business is House File 1512 from Representative Hanson. Representative Hanson, if you'd like to come down to the testifier table and move your bill.
Thank you, Chair. I move that House File 1512 be included for, be laid over for possible inclusion in our omnibus bill.
Okay, and I understand that you have an author's amendment. If you'd like to move your author's amendment, and please explain it.
Yes, I do have an author's amendment. Thank you, Chair. This amendment is a DE amendment that followed conversations that happened with DHS. And so this is with all of the technical assistance they always provide for us, and also getting the bill in the shape that I would like it to be in.
All right, any questions on the amendment? Hearing none, all in favor of the author's DE1 amendment signify by saying aye. Aye. Opposed? Motion carries, and the author's DE1 amendment is approved. We will now go on to testify. Well, Representative Hanson, if you'd like to explain the bill, and then we'll go to your testifier.
Thank you, Chair, and thank you, committee members. As amended, House File 1512 allows people with compromised immune systems to use virtual services to receive their PCA services. This will allow them to visit with their qualified professional, also known as a QP, remotely without having additional agency workers in their home to conduct visits. This includes people receiving services who live with someone who has a compromised immune system as well. We've seen the successes of innovating with technology to do more with virtual meetings, and now we can turn this into change to better protect the health and well-being of up to over 44,000 people who are receiving PCA services here in Minnesota. 63% of those recipients are Black, Indigenous, or people of color. Many recipients live on low incomes. They live in multi-generational households, and they're facing the disproportionate impacts of COVID-19, the flu, RSV, and other public health risks. Communicable diseases are a very real risk and a real threat to people with disability in our communities. Minnesota winters don't exactly allow for open air and outdoor meetings like our summers do. So this bill feels like a common sense approach to avoid exposing vulnerable people to unnecessary risks. This bill will not allow everyone to receive PCA services remotely, and by no means can all PCA services be done remotely. Agencies cannot opt out of doing in-person visits altogether, and remote visits must be approved by the service recipient's physician and will be documented at the agency as such. The goal of this bill is simply to ensure that our most vulnerable PCA recipients can receive qualified professional visits while also creating safeguards for program integrity. Thank you, Mr. Chair, and I'll turn it over to my testifier now.
Right, thank you, Representative Hanson. We will go to Noel Domir, if you like.
Noel Domeyer.
Domeyer, go ahead, Noel.
It's okay.
Thank you.
Thank you, Chair Fisher and the committee. I have never done this before, nor have I public spoken anywhere, so if you catch me off guard, I might stop for a moment to get myself together.
No problem,
Okay.
just take your time.
But I am very passionate about what she's talking about. I've been a nurse for almost 25 years and worked kind of like a candy striper with growing up with a brother with a disability who's on waivered services, so I have quite a history. My name is Noelle Domeyer, and I'm working as a registered nurse and a qualified professional at this time for Best Care. It's PCA 245D, and it's Fiscal Management Service Provider. I am grateful for the opportunity to testify in this bill. And thank you, Representative Hanson, for authorizing this bill. My caseload as a nurse working in a PCA world is so much different than case management for Fairview and Align and home care. It's approximately 135 to 150 client families, not including their PCAs and their family members and the responsible parties. That's over a given year, but keep in mind that I may see up to 4 people in one day, and I'm jumping around from home to home. Like Representative Hanson had mentioned about the summer, that is that flexibility where you might be able to see somebody outside, maybe on a porch or through a screen door. But in the reality of that, when I was reading that, the majority of the clients that I serve don't have houses with screen doors and porches, don't live on a ground floor with a window, and that makes it really difficult in order for me to do those visits that way and respect their wishes for what they have been through and how many hospitalizations they've been through because of COVID already. Rehospitalizations, ER visits, watching family members pass away from them, and then I'm trying to persuade them to let me come into their home after my 3rd visit. If not, their service will have to be put on hold because we're not meeting the requirements. That creates a lot of anxiety for them and triggers a lot of mental health issues that I could have avoided if I could have worked around it in another way to meet their health and safety needs. Doesn't have to be sitting on their couch, doesn't have to be in front of them, unless it's a situation where that person wants you to be there and you're able to do the social distancing 6 feet away at least, wearing a mask, making sure it's worn correctly, that they both understand. I've had some of the best visits of my 7 years of being in the home since COVID, because I've been able to build a rapport and really open up and talk to people who are very lonely and get to know their medical history in a way that I hadn't before, and I think that has been very successful. I've also witnessed a lot of deaths.
Take your time.
Excuse me. Back in the mid-90s, I worked at a bone marrow transplant unit. That's when I had this aha moment. These children and adults were immunocompromised. I walked into an isolation room, prepped myself with a mask, a gown, and glove, just out of habit, walked in, and they don't get sick. If you had symptoms, even if you wore a mask, gown, and a glove, you couldn't go and visit them. These people died. There was only one person in an ISO room at a time, or one adult or a pediatric patient. Now I'm asked, I feel forced, to go into a home of multi-generational patients. Grandma's laying on the bed with oxygen, and she has pancreatic cancer stage 4. She's very immunocompromised, but she's not our client. Our client is a woman my age who has autoimmune disease, and she has 3 kids, and they're also clients. I find it very challenging to go in there and feel safe. Even if I get tested ahead of time, I have an 80% chance that that might be successful if I tested correctly. I feel more comfortable having a medical professional make that decision whether I should be with them for more than 15 minutes, asking questions that I can do very well when I'm doing it on a video call. I see they're alive, I see their color, I listen to them converse, I can tell if something's not okay because I've been working with them for 7 years. There's a history. It's so different than working as a home care nurse for Alina. This is the only nursing job I have ever found in 52 years where I can start with somebody before they're diagnosed with an autoimmune disease and watch it progress and be there through their hospice stage, which I did for 9 years. And that's why I think this bill is very important.
Okay. Thank you for your testimony, and thank you for sharing with us today. It's been very educational. And I see a number of hands going up. Representative Keel, and then I've got Representative Baker.
I'm good.
You're good?
And I'm open to any questions.
Okay, certainly.
I'm good.
All right.
Thank you, Mr. Chair. Appreciate it. When I'm listening to you talk, I can about imagine the challenges. Is it important for you to be in that setting at least once in a while to make sure that you're seeing the whole setting when you're working with a client?
Ms. Domeyer, go ahead.
I'm sorry, can you repeat that question, please?
When you treat that patient and you're doing telehealth, is there times when you go in personally? Maybe I missed when you were talking about it. But do you go in to get a setting, a feel for what's going on in the, whether it's multi-family, generational people, or let's see, so that you know what the setting is what I'm really asking.
Yes.
Ms. Domeyer.
Thank you. That's a very good question. How the PCA world works for my role is it's done initially by an assessor who assesses that condition. And if I'm lucky, I'll get the assessment and it'll give me a breakdown if this client lives with family, multi-generational, if they live alone. Often that isn't part of the summary. So I know what I need to ask when I see diagnoses and when I see medications. I get an idea of what that person has. I ask them if they live alone. I've learned what to ask. But my initial visit, I do go into the home, and I have been, except for COVID, so I can get a general idea of what's going on. If not, I will ask those questions to make sure I know who's there, so they're not alone. And then if they live alone, I have other questions I need to ask because of that.
Representative Keel.
Thank you, Mr. Chair. I guess I can appreciate the distance because of the the immunity situation. I also think we have to be careful how much we're away from people, so that when they are alone, there is no human touch. I think that that's super important. So my other question would be is, if we do this, is there a federal issue? Do we have to seek changes federally to be able to do this?
I'll go to Representative Hanson or Ms. Domeyer, or is that more of a, go ahead, Ms. Domeyer.
I do have a comment in regard to them having somebody there. I agree with you. The loneliness, it's an epidemic because of the COVID, and I found that's why I'm building a rapport. That's why they're opening up, and I'm learning so much more about them. And what I'm learning is, what do I ask to assure they are not alone, and how can I provide resources if they are? Do they have home care nursing, skilled nursing coming in to check their vital signs, fill out their medication box, and so forth? Do they have in-home therapies? Do they have arms workers? Who comes in besides their PCA? So I'll know if they're not alone, but in my role, I have such a limited time that I don't do hands-on anymore. That was the hardest part of not doing nursing. In fact, I can't. It's against the regulations. So I'm trying to find resources for people that live alone and services.
Thank you. And then Representative Hanson, do you have anything to add?
Thank you, Chair, and thank you, Representative Keel. I got the nod from DHS that there's a maybe, so I will need to follow up with you just to double check and make sure that there's not. This is going to be laid over for possible inclusion, so we have an opportunity to continue having that conversation, and so I'll commit here on the record to getting that information back to you.
Thank you.
And I do believe staff has a additional information. Go ahead.
Mr. Chair and Representative Keel, I was just going to point out on lines 1.14 and 1.15 of the amendment, it prohibits the PCA agency from conducting the first supervisory visit remotely.
Okay. Thank you, Representative Keel. Okay. And I'll let folks know that after this committee stop, it's also going to Human Services Finance. So if there's other issues that we can also deal with between now and then. Other questions? Not seeing any. Representative Hanson, would you like to make closing comments and renew your motion?
Thank you, Chair, and I need to correct my motion because I said laid over for possible inclusion, so I just want to set the record straight on this. I make a motion that House File 1512 as amended be re-referred to the Committee on Human Services Finance, please.
Thank you, Representative Hanson. Representative Hanson renews her motion to refer House File 1512 as amended to the Human Services Finance Committee. All those in favor of the motion signify by saying aye. Aye. Those opposed signify by saying nay. The motion prevails, and House File 1512 as amended is re-referred to the Human Services Finance Committee. Thank you to our testifier today. Next, we will be going to House File 1384 from Representative Hicks. Representative Hicks, if you'd like to come down to the testifier table and move your bill. Representative Hicks, go ahead, please.
Thank you, Chair. I move to refer House File 1384 to the Human Services Finance Committee.
Okay, Representative Hicks has made the motion. I understand that you have a DE1 authors amendment.
I do. Thank you so much. This amendment is to help get it in the shape I need it to be in. It removes the premiums for MAPD and allows those who have been disenrolled from this program due to high premium payments to enroll without penalty. As we've been in conversations with the department attempting to address the burdens brought by this high premium scale, which, to be fair, has been really difficult for 15 years. And the legislature has worked hard to try to make it better, but it still has not gotten sort of in the shape it needs to be. The research sort of led us to the most effective and equitable way to address this issue is simply to remove the premiums altogether. The amendment deletes the old bill language and inserts the new language to reflect this change.
Okay. Is there any discussion on the author's DE1 amendment? Hearing none, all those in favor of adopting the DE1 authors amendment signify by saying aye.
Aye.
Those opposed? Motion carries and the DE1 amendment is adopted. Representative Hicks, is there any other explanation you would like to provide us?
Not on the amendment. I'll just give you a little overview of the bill. This bill ends what I believe and I believe our advocates will share with you the unacceptable practice of taxing disability. Medicaid for Employed People with Disabilities, or MAPD, is a critical program for our state. It was established over 20 years ago to fill a gap in our Medicaid system to allow people who have disabilities to receive the long-term care supports and services they need to receive medical assistance while also working and generating income and contributing to our overall communities, just like workers who don't have disabilities. While this program was created to make it easier for people with disabilities to work, the way it is currently set up with asset limits, premiums, and significant administrative burdens creates a barrier to employment, and it keeps people with disabilities living in poverty. Many accessing this program face financial distress as they are under constant threat of losing their safety net supports. H-File 1384 was created directly by people who are using MAPD. Each change in this proposal would directly impact them, their families, and their communities. House File 1384 makes the following changes. It removes the asset limit and premium so that people with disabilities can make more and do more than just survive, but also thrive. It expands eligibility for Medicare savings programs to all recipients who are dual eligible for MA and Medicare and required to enroll in Medicare, if you're not aware of that requirement. And it ensures that those who have been disenrolled due to high premiums can re-enroll without penalty. Today, you're going to hear from advocates who worked directly on this bill. But before that, something I want you to understand is that individuals accessing MAPD are paying taxes. Many are paying for other insurance like Medicare or private insurance through an employer in addition to their MAPD premiums. And for those who need long-term care services to be able to remain in our communities and live their best life and participate in our communities, this is only possible through medical assistance. They have one avenue to stay in community, and we charge them for it. And we charge them a lot for it. This is why this is an unnecessary and inappropriate tax on disability. This bill will also provide cost savings to the state in relieving DHS and lead agencies of the administrative processes and burdens of calculating and collecting premiums. I will stop talking and let the experts share their stories.
Thank you, Representative Hicks. And the first person I have is Rob Woodlick. If you'd like to introduce yourself and begin your testimony there. I think we've got...
Going through, or
Not hearing it right offhand.
how about this one?
I can hear that one.
All right. Yeah, we're good. All right. Well, thank you, Mr. Chair, members of the committee, you know, really, this bill is about equality for people with disabilities, and you know, I'm a quadriplegic. I depend on my state and federal services to survive. Basically, I need almost 24/7 home care, and you know, if I had to pay out of pocket, it would be $400,000 a year. So unless I won the lottery, there's no way I could, you know, have to leave the state disability service program. You know, I also want to work. I want to contribute to the community, and I want to build personal opportunity and growth just like anyone and have stability in my life. You know, I have a history doing nonprofit work. I currently work at the University of Minnesota in clinical research for the Department of Rehab Med, and I have my own business that's developing medical devices and assistive technology to help people. And I have a few employees, and it's, you know, bringing money into the state and helping fuel taxes. So I'm proud of that and proud of my company. But, you know, the sad thing is if it does well enough, my asset limit right now is $20,000. And you can't run a successful business with that kind of limit. I'd have to either put the brakes on it or give it away, basically, and that's not fair for somebody that works hard to try to, like myself. So, you know, these services, I had to go to a doctor to prove that I'm disabled. I have to talk to somebody every year. Still paralyzed, so yeah, you know, this isn't. You can't really fake getting into this program to get benefits, and I just want to really make that clear. You know, I would either be working or I would not be working, but I'd still be on the benefits, and I don't want to have to choose. You know, I'm testifying on behalf of myself, but I have a lot of friends when I first got introduced to this option. I've had friends, disabled friends, have to turn down like raises, employee stock options. They can't buy accessible vehicles. They can't afford food. And we'll hear more impact from Brittany and Jillian. You know, and it's just kind of lifting the ceiling over people that really have a low ceiling put on them already. So, and you know, this fiscal analysis might look high, but again, you know, once you're disabled to the level that you need community health support services, you're going to be in one bucket or another. So it's, yeah. So thank you, Mr. Chair, members of the committee. And
Thank you very much, Mr. Woodlick. Next I have Jillian Nelson. If you'd like to go ahead and introduce yourself, welcome to the committee.
Good afternoon, Chair Fisher and committee members. I'm Jillian Nelson. I'm the Community Resource and Policy Advocate for the Autism Society of Minnesota. Many of you also know I'm an autistic adult, and I'm a recipient of medical assistance for employed people with disabilities. This program has changed my life, and I know I've shared with this committee how impactful having my PCA support has been to my life. I'm here today asking you to support House File 1384. Paul Wellstone once said, "It is the belief that the extremes and excess of inequality must be reduced so that each person is free to fully develop his or her full potential." The current structure of MAEPD is built on a foundation of excess and extreme inequality, essentially charging a high tax and a heavy administrative burden for the unchosen reality of being disabled. A study by the National Disability Institute in 2020 showed that people with disabilities pay over $17,000 a year more than a person without a disability just to exist. In the community, we call this the disability tax. This is all the things we pay extra for to live an accessible life. Like, I need a mattress that reduces chronic pain. Brittany needs an accessible apartment building that is twice as expensive as mine. Rob needs certain tools and things to live his life as well. I need sensory tools. These are countless things that we pay for to make the world as accessible as possible. For me, one of the biggest contributors of that disability tax is my MAEPD premiums. Every month I make choices. Do I pay my premiums or do I pay my car payment on time? Pay my premiums or buy produce and non-processed protein? Pay my premiums or pay my electric bill in full? I shouldn't have to make these choices. No one should have to make these choices. This choice, however, is very, very simple. Pay my premiums. Because without my premiums, I don't have the support I need to survive. MAEPD premiums were put in place when this program started to give a vehicle to give disabled people pride, so that we could feel pride in contributing. I rarely feel pride being forced to choose between my premiums and everything else. I would be proud to be financially stable. I would be proud to have a savings account with more than 2 digits, and I would be proud to someday be able to afford to buy a house. This is why we need to eliminate the premiums for MAEPD. This change is not going to result in a mass accumulation of wealth, but it will offer us some relief and reduce the cost of being disabled. It will be the start of lifting ourselves out of forced poverty of the disability system. MAEPD participants are currently paying 7.5% of their income, at only 150% of the federal poverty guidelines. With cost of living on the increase and the reality that most people with disabilities are underemployed and underpaid, 7.5% can make a big difference in quality of life and being stable. I do not need to pay a monthly premium to contribute. By working, I am contributing to my care. By being a taxpayer, because as Representative Hicks said, I am required to carry my primary insurance through my employer. My insurance is the greater contribution to my care than my premiums ever will be. My private employer-based insurances pay an average of $80,000 a year before MA is responsible for anything. So MAPD provides only what my primary does not. This is how I contribute to my care as an employed person with a disability. The elimination of MAPD premiums would mean a better life for me and everyone else on this program. And as we learned from Paul Wellstone, we all do better when we all do better. Thank you for your support today.
You're welcome. Thank you for your testimony. Next I have Brittany Wilson. If you'd like to come down, introduce yourself. Thank you for being here again. Good to see you. Please introduce yourself and start your testimony.
Good to see you too, and thank you. Good afternoon, Chair Fisher and committee members, for allowing me to testify on this bill. My name is Brittany Wilson, and I'm honored to be here to speak about a program that I have been fortunate enough to be on for over a decade. I was born with a joint and muscle condition and navigate life through using an electric wheelchair. And like so many other people in the disability community, I grew up with an understanding that if I made too much money, I would be kicked off of Social Security and state services that I need to live, including the caddy waiver and personal care assistance. It wasn't until about 2 years after graduating from college that I learned about the Disability Hub and made a call that would change my life. I learned about MAEPD for the first time. I learned that I could work while earning competitive wages and still get the help that I needed. I couldn't believe it, and honestly, I still feel incredibly lucky to live in a state where this program is available. And this is why we want to ensure that notice is given to people that are accessing this program who indicate that they have a disability of the existence of MAEPD. This program was implemented before I graduated high school. And every year at my IEP meetings and my waiver reassessments, when I was asked about my goals, I mentioned working, moving out on my own, owning a home, and still no one told me about this program. Even when I started working my senior year, earning competitive wages and was on the Ticket to Work program through Social Security, even when that ended and I quit working, because I didn't know another pathway, right? And everyone around me that had the power to tell me about this program didn't. No one told me. Once, it was my persistence, my willpower, my stubbornness, and my privilege that helped me find out about this life-changing program. And once I learned about it, I was informed that I also needed to apply for Medicare. And if I were eligible, I'd be required to enroll in it. Currently, if your income is less than $27,179 or 200% of the federal poverty guidelines, you can have your Medicare Part B premiums reimbursed. How many of you could live on $27,180 as a single person and also pay additional health care costs on top of premiums? Expanding the eligibility for the Medicare Savings Program will help financially stabilize individuals who are duly eligible for MA and Medicare, which most people on this program are. This is the only way working people with disabilities who need home and community-based services can access them. This is the only option we have, and we have to pay to access it while also working and paying taxes and other healthcare costs. And simply put, like the others have said, that this bill is about equity. Our health and human services programs are supposed to get people with disabilities to the starting line. Unfortunately, many can't even get there because of barriers like the asset limit, the premiums, and the administrative barriers of the current program. Why do we keep putting this additional burden on people with disabilities just to get the care that we need? It is truly a tax on disability. Today, I am the Equity and Justice Director for the ARC Minnesota, a job that I could not have without MAEPD. Every day, I get to help advocate for thousands of Minnesotans with disabilities. I get to be the representation that I was searching for growing up. When parents and advocates come to me and ask me about working, I get to tell them that there is a pathway for people with disabilities to do more than survive, but also thrive. And thriving looks like not being scared to lose my care while also struggling to pay for the premiums and Medicare costs just so I can be in the workplace. Thriving means feeling like I deserve to work and be a part of society while also having the access and support that I need to survive. It's been 20 years since this incredible program was implemented, and in that time, the people on this program, the people that are here today in front of you, we know the gaps, we know the barriers, we know that the ways that this program stops us from living our full potential, and so I really hope that we can have your support on this, because as the system is currently set up, it can make people have to choose between the impossible. So thank you. Sorry to be a blubbery mess, but this is our life. So thank you so much for your time today.
You're welcome, and thank you for your testimony, your passion. We appreciate it. Thank you for sharing your experiences with us. At this point, I'll ask, is there anyone else from the public who'd like to testify? Mr. Hughes, if you'd like to come forward, introduce yourself.
That's right. I can get close to Rep Hicks this way. Hang on now. I'm too long-legged to sit behind the desk, so I got to do this. Say, members of the committee, Chair Pete Fisher, my name is Mark Hughes. I've served 12 years on the Minnesota State Council on Disabilities, which by law is all you could do. And I've learned a lot of things. But today, a 7.5 or 6% disability tax. And all the mornings I've got up at 5 in the morning, I've never heard of it. Why do we have to have it? Why do we have people in here crying and upset when it's a quality of life issue? It's a stick man of life. Must have and nice to have. Do you mind if disability people had jobs and insurance so we wouldn't have to worry about all this? What are we going to do about it? And when? How about tomorrow? I am upset. This has gone on for years. We've had a ticket to work program. I started in 1982 here in the House, believe it or not. That means I'm old. But under Jim Ramstad and Jeff Bangsberg, we wrote the ticket to work program, whereby you could work and keep your benefits. Why should we be afraid because we don't make 27,000 some odd dollars that we'd lose something? I once had a case, his last name was Carlisle, and he testified here in the House and Senate. He said that he was about to retire, but when he was going to retire, his benefit package would change. He might lose his house and his van that he had to have with all the apparatus on it. That is ridiculous and unheard of. Why did you work 40 or 50 years to retire to lose everything you've worked for? There is a round peg in a square hole, and it's upsetting me. So what are we going to do about it? Let's see about getting the governor. We have a surplus now. Let's help these folks out, and right now. Thank you.
Thank you, Mr. Hughes. All right, with that, we will go on to members' questions. I have Representative Baker first.
Thank you, Mr. Chair. Representative Hicks, I'm just curious, again, I support this concept. It does seem like it's overdue. How did we come up with the percentages that you're presenting today? How did that follow a model of the percentages at this percentage federal poverty goal and guidelines of the 2.5 to 4% and so on? How did these numbers come to be?
Representative Hicks.
Thank you, Chair. So I guess what you're asking is how do we calculate the premium?
Yes.
And the long and short of it is the legislature has determined that, and every couple of years, these folks come in here and they beg for you to accept their dignity, and they beg for you to recognize that without these services, they can't work and they can't participate in their community, and that they're valued community members. And they cry and they get angry and they testify in front of all of us, and everybody moves the needle a little bit and says, happy for you.
Since the inception, our premiums have never changed.
Oh, only Tefra?
Mhm.
Okay. Arbitrary number at the beginning. Sorry, Tefra's the one where we've come and begged every 2 years. So as a disability advocate, I have sat in this room, I have sat at these tables, I have talked to folks over and over again, and it just keeps happening.
Go ahead, Jillian.
To bring light to that too, there's very few fee-for-service programs on Medicaid. The two primary ones are Tefra and MAEPD. Tefra has seen a significant drop in premiums, but this program has been left behind as we have moved that. And it's time for us to not be left behind and to stop being charged to have to pay to be productive members of society.
Thank you. Representative Baker.
Mr. Chair, again, I appreciate that. I think I'm just trying to find out, again, there's no fiscal note yet. I know it's coming. Yeah, and no. We're not a financial committee here. My question is, again, were these numbers that came from something that was used somewhere else? I mean, this is important. Was it just kind of numbers pulled out of the sky that you thought was right and fair? I'm just kind of wondering how we got there, because maybe if we have to tweak it going forward to be able to afford it is one thing too. So I wanted to understand if there was a background of the methodology of finding that. That's all. So again, it's needed. It's certainly needed. I'm just trying to get the right secret point there.
Representative Hicks.
And I do want to talk about the affordability piece, because the piece of this underlying cost that we haven't really talked about is how much it costs the department to calculate, right, this arbitrary number, and then also to collect premiums. And so I think it's important that we recognize that charging someone for something doesn't have a cost with it as well, right? There's folks that have to calculate the premiums. County workers have to collect all of the data. It has to be sent up to DHS. People have to do all of the math, confirm all of the things, set the premium amount, and then if someone can't pay their premium, they have to get that, they have to use collections, and they have to do all of those things. Oh, okay. So there's all of those pieces as well. And so it was 20 years ago, and I thought it had changed, so I was mistaken, and appreciate my advocates knowing more than me. But if we're looking at really trying to make this a program that is about incentivizing work, we incentivize work by removing the barriers that make working more bad, period.
Thank you. Okay, thank you, Representative Baker. Next, I've got Representative Backer.
Yeah, thank you, Chair, and Representative Hicks. I would agree anytime we can incentivize work, and I appreciate the testimonies, because that is good for the state, it's good for our country. My question is how many folks are enrolled in this program, the MAPD program? Roughly, I'm not looking for but is it 100, is it 200? Thank you, Mr. Chair.
All right, thank you. I see Ms. Nelson has her hand up, but if you'd like to take a swing at that.
It's approximately 12,000 when we received the financial report from DHS last year.
Okay. Representative Backer.
Thank you.
You're welcome. Next, we'll go to Representative Coran.
Thank you, Chair. And Representative Hicks, thank you for carrying this bill. As you know, I'm fully in support of this, and I too, in addition to the testifiers we have today, I know several individuals who look forward to seeing this change happen. And my question more is more of a technical change for Representative Hicks. I understand this has more stops. So I would just point to when we're looking at the DE, since that's what's before us, line 1.13. It talks about a member of a household with 2 family members, and then describes that as husband and wife. Just wanted to point that out, and wonder if we can work on just a little quick amendment to change that to spouses.
Representative Hicks, go ahead.
Thank you. Yes, we will get that fixed immediately. This is how long it's been since we've looked at this bill.
Thank you, Representative Hicks. Representative Cran, anything else?
Nope, that's it. Thank you.
All right, thank you. Seeing no other comments, Representative Hicks, would you like to make any closing comments and renew your motion?
Thank you so much, Chair, and thank you so much, committee members. And we will have a fiscal note, and we will have another stop, and we're going to fix that suggestion. But I just want to say that work is a part of life. The ability to choose to work, the ability to choose how much to work, the ability to choose what work brings you purpose is incredibly valuable. People with disabilities should not have to choose between the services that keep them on the planet and healthy and their right to choose productive work. So I ask for your support as we move this bill forward, and I look forward to support as we move it forward throughout the session to really fix this for everyone with disabilities.
With that, Representative Hicks renews her motion that House File 1384 as amended be re-referred to the Human Services Finance Committee. All those in favor signify by saying aye. Aye. All those opposed say nay. Motion carries and House File 1384 as amended is referred to the Human Services Finance Committee. Thank you very much to our testifiers for being here today and sharing your experiences with us. Members, our final bill today is House File 1466 from Representative McDonald. Since Representative McDonald is not a member of the committee, I'm wondering if Representative Keel, if you'd like to make the motion to refer House File 1466 to the Human Services Finance Committee. Representative Keel.
Yes, Mr. Chair, I would move to refer House File 1466 to the Finance Committee.
All right, thank you. Very good. Thank you for making the motion, Representative Keel. We will go to Representative McDonald. Welcome to the committee today. I understand you please explain your bill, and I understand you have some testifiers. So please go ahead and start, sir.
Thank you, Mr. Chairman. The committee members, always your favorite words. This is the last final bill for the day, right? So thank you for having this bill being heard. Representative Fisher, Chairman. I was on the committee here for 4 years, my first 4 years. You're doing great work indeed. So I appreciate the work you're doing. I'm not being trite. It is a hard committee to be on. And I thank you all for doing God's work, if you ask me. Today, before you, 1466 is a bill that has been around since 1979, or at least the act, advocating change together, something that my father, who served in the House from 1977 to 1990, helped work on. So I'm proud to carry on some of his tradition in helping the community. So before you is a bill that will help the disabled community be integrated into society and have a quality of life like each and every one of us have now and like they deserve. So I'm going to read just a couple of things that I prepared so I don't go on too long, Chairman, because it is an exciting, really wonderful bill, a wonderful program. You're going to hear from Mary Kay, who's been working on with ACT for the last, since 1979?
Nope.
No, you're too young for that. So you're going to hear her speak as well. So in this very committee and in various settings across the state, there are important conversations taking place on how we as a state to support Minnesotans with disabilities to have meaningful lives in our communities. Lives based on their own choices on where they live, how they live, where they work, and where they play. These conversations are resulting in many innovative ideas on how to move towards this shared goal while using state dollars in the most cost-effective way, including ideas for reforming existing programs, increasing choices for individuals around how they can use limited support dollars, and more. However, community inclusion can be successful if guided by self-advocacy groups. Here in case ACT will take over. Individuals with disabilities naming their own vision of what they would like to see their lives look like. That self-advocacy must be the foundation, whether it takes place in their own family, in their place of work, school, or living, or in their local community, or here at the Capitol. Or to put it another way, people with disabilities must share the leadership of this work for their own inclusion, and that's the beautiful part of this program. The grants that are before you today in the bill are funds that proposed in this bill which supports specific activities focused on the development of these leadership and self-advocacy skills in Minnesota with disabilities. I've carried this bill for the last 5 years. It's been around for very long. It's something that every 2 years we have to come before the committee and ask again for the funds that do this great work. Someday, we hopefully, Mary Kay, we get this into the funds that we don't have to come back every 2 years, but it's a good, responsible way to come back and share this great program. With that, Mr. Chair, I'd like to turn it over to my testifier with your permission.
Thank you. Mary Kay Kennedy, if you'd like to introduce yourself, welcome to the committee and begin your testimony.
Thank you, Chair Fisher and members of the committee. We really appreciate the opportunity to give testimony today. My name is Mary Kay Kennedy, and I'm the Executive Director of Advocating Change Together Center for Disability Leadership, or the ACT Center. So you might be surprised, or you might not be surprised, to know that like the rights that people have when you write them down on paper, they don't automatically just transfer over and then, oh, people have those rights now. A lot of people really don't know that they have these rights. And that's what we're all about, is kind of bridging the gap between what rights people have and the rights they know about and are supported to exercise. So I just wanted to give you a few examples. We have so many examples, but you know, we're meeting with people across the state, people with disabilities, and these are just a few things that we've heard recently. My foster mom doesn't allow me to have any guests in the house. No one can come over to the house. No barbecues, no, it's the foster care's home. My brother says I need to stay put because if I move and live somewhere else, I will not have any way to get to my doctor appointment. They will not allow me to order food from my favorite restaurants because they want me to lose weight. So these are just a few examples of folks that are clearly on the wrong side of the disparity gap. They don't really know their rights, and they aren't being supported to figure out how to exercise them if they did. So the good news is that when we provide disability inclusion supports and training, we really do see fabulous results. So we see people joining community gardens, inviting their neighbors over for root beer, creating volunteer clubs and going out to volunteer, learning to use Lyft and Uber, hosting dinners and picnics, being part of the community side by side with everyone else. So just in short, we're just trying to close that disparity gap for folks and kind of widen their idea of what might be possible in the world. So the legislation before you, or the bill before you, allows us to continue to maintain a statewide network of groups, reach more people, help people build a stronger awareness of what their service options are, host conferences, big and small, and most of all, position people with disabilities to play a meaningful role in Minnesota's Olmstead plan. So I think everyone has this report in your packet, is that correct? Yep, so I would just invite you to take a look at that. Each page represents one of our programs, and then I think the most powerful piece...
Excuse me, we did not get it, but if you could get it sent to us, then we can get it electronically distributed to the committee.
Sure. Okay. Yep. So when you get that, I think, to me, the most powerful part of the report are the quotes from the participants. So this just tells who we are. So we've got two people that would like to testify. They're both staff people with Advocating Change Together. And I'd like to first introduce Shantae Martin. And Shantae was just hired by us. She's gone through many of our programs, many of our leadership programs, and now she is in a position to be a leader and a teacher.
Okay, thank you. Welcome to the committee. Please introduce yourself and begin your testimony, and thank you for being here today.
Hello, everyone. Hello, everyone. Thank you, Chair Fisher and committee. My name is Shantae Martin. I am here for my testimony today on behalf of ACT. When we do activities with ACT, we do a lot of conferences. As Mary Kay said, we do a lot of conferences. When we do a lot of the dance programs and all the other talk to the legislators and be able to be in this type of advocacy. When they hired me, I wasn't a teacher yet. I was still on the board. So now I'm officially a teacher, and I'm glad to be able to teach other people about their rights, and I'm so glad to be here to represent ACORD, which is what I teach. And things like that, and to be able to talk to everyone. I lived in a foster home since I was 18 months old. I lived with a woman by the name of Marcella Martin. She was my foster mom. I lost her. She basically died in 2021 at the age of 92. I lived with 20 siblings and 20 adopted siblings as well. To be able to have all these activities, to be able to be on the ACT teacher, and to be able to have these ACT picnics during the summer, doing all these fun activities with ACT and everybody else. ACT has been a life-changing thing for me because it's been changing my life. I know so many people that I could thank. So many years ago, I started in 2009. I started with the ACT by the guy named Rick Hardelius. He's the one that was with me when I first started. I was like in my 20s, in my late 20s. Rick Hardelius has changed my life due to his passing. I appreciate all the things that he's done for us. ACT has been in my life for the last 20 years, and I'm so proud of all the succeeding that everybody's been succeeding. I've been seeing a lot of people that are so thankful to have an advocate of the year like me to teach them all the stuff that they need in the world. Without these classes, without these teachings, I would never have this type of opportunity to be here, to be able to speak in front of the committee today. I was so excited. I've been through a lot in my life, and without this ACORD being around for the last 50 years, we would never have this place. And there's so many things in this world that I'm thankful for. I'm thankful for my mother. I'm thankful for her. I've been living in the Ronald community for years. I worked at MTS. That's where I first started working, and now that I work as a teacher's assistant doing cow tipping as well. Thank you for the opportunity.
You're welcome, and thank you for taking the time to come and share your experiences with us. Next, we have Cynthia Gales, from I understand, and I'll let the committee know we are coming up at the end of our time here, so after the testimony, I'd like to make sure that if there's any questions, we keep them quick. We're supposed to finish at 2:30. I think we can go a couple minutes later, but want to make sure we get our testifiers in. So, Ms. Gales, welcome to the committee. Thank you so much for being here today. Please introduce yourself and begin your testimony.
Thank you, Chair Fisher and committee. My name is Cynthia Gales, and I just want to thank you for having me to tell how advocating change changed my life on a personal basis. It changed my life completely. I used to live in a group home. That was the worstest thing I had to deal with in my life besides being disabled. I was constantly belittled every day, told that I couldn't do this, I wouldn't be able to do this, and I never could live on my own. And this is all because I have traumatic brain disorder plus a couple of other disabilities. So as I was in my adult daycare class, I heard about Mary Kay Kennedy and advocating change. So I was like, well, my fate has already been delivered. I'm not going to be able to do nothing no way, so why would I be interested in this class? But somewhere in my mind, I haven't forgot everything, but some things I do forget. I was like, I want to prove them wrong. So I went to the classes, and the more I went to the classes, the more I learned that people with disabilities do have rights, and they can live the way they want. So I've been working with Mary Kay Kennedy and them and Advocating Change Together program now for 8 years. And what's so good about that is now I've been living on my own for 2. something that they told me I couldn't do. But the more I learned about the program, the more engaged in the program, I became stronger. I found my self-esteem. I know how to speak up and advocate for myself now. You know, I've been with this, like I said, I've been with them for 8 years, and I feel great about myself, within myself, that I just didn't let them tell me I was going to be a nobody, and I could never do this, and I could never live on my own. So I proved them wrong on that. But the thing is, the sad part about this is that there's hundreds and thousands of Cynthias out there that don't know that they have opportunities, and they can, and they, even if they got a disability, they do have rights, and they can live the way they want to live. If this is possible, and I tell them this through my own experience, and I've been at different parts of Minnesota advocating and recruiting people to join the ACT team, because I feel like if I could tell them my story and I can get through it, and that was really bad and rough for me to live in a group home and be told every day that I was good for nothing. So if I could do it and make a change, they could too. So I just want to say thank you for letting me come in and tell you a little bit about my experience. And when this might be a little too much, but when I get through telling my story and saying what I got to say, I say one thing. I say, not just me, but we. And the people that I'm talking to, I also have them to repeat that after I say it. So if it's not too much, could you say, not just me, but we?
Not just me, but we.
Thank you so much.
You're welcome. Thank you so much, Ms. Gales. Appreciate you being here. Ms. Martin, thank you for being here.
All right.
And I see Mr. Hughes, if you'd like to come up.
And I'll be brief.
Okay, thank you, because we are, oh, and I see Jillian coming up. We got to be real brief because we're past time right now, so
I can't get my long legs into the desk. So
I understand that.
would you pass me the microphone? There we go. I understand this other one. Again, Mark Hughes, and I've been around here a long time, but there was a name mentioned today, Rick Cardenas, and he did pass away. And I just want to reiterate, he was the king in the disability community.
Yeah, he was.
He did a lot for ACT. He helped put it together with Mary Kay Kennedy. These two are a real asset. So anything that is afforded from this committee or at the end of the bill as far as revenue exchange, I can't tell Mary Kay what to do for Rick Cardenas in his memory, but I hope something is done. Thank you.
Thank you, Mr. Hughes. Ms. Nelson, if you'd like to go ahead and reintroduce yourself and quickly, thank you.
Thank you, Chair Fisher. I'm still Jillian Nelson with the Autism Society. I just want to warmly ask for your support for this bill. It is advocacy programs like this that taught me my rights and led to the career that you guys see unfolding in front of you nearly every session, it seems, at this point in every hearing. So thank you for your support of this.
Welcome. Thank you. Representative Edelson, you had a question, quick.
Really quick, Mr. Chair. So thank you to the testifiers. I'm thankful that you guys came here today and your courage to testify. You're both an inspiration. Representative McDonald, you can just stay there. Why on here why are we not listing advocating for change together as a direct appropriation? I just want to know what the story is behind that, because right now it says the Commission of Human Services for a grant to an organization governed by people with intellectual and developmental disabilities. So it doesn't actually list them specifically. They would have to go through a competitive grant process. So give me more.
Representative McDonald.
Mr. Chairman, Representative Edelson, we've been trying for a number of years to have it an appropriation ongoing. At this point with the grant money, ACT always gets the applicant, they send their applicant, they're always receive the funds for the program. But I think Mary Kay would probably be better suited to answer that question as to how they get the Department of Commission from the Health and Human Services appropriate the funds to ACT. Okay. But I agree with you, they should be listed in their funds. So
Director Kennedy, if you'd like to go ahead, please.
Yes, thank you for the question. And I guess I'm not really sure. I mean, I know that how it's been set up is the state of Minnesota, DHS, puts out an RFP every 5 years, and then we respond to that RFP. To my knowledge, we're the only ones that do respond to the RFP because it is to do exactly the work we're doing. But I don't know why it does not have our name on it.
I think very quickly what part of that goes into is that there's a lot of back and forth on it, but there's a number of folks that prefer not always having people or organizations named, so that the department then is able to do a request for proposal. While you may only have one group that does it, the people feel that it's a little bit more open of a process, and so that's why you see a lot of times that there won't be a specific organization name, but there'll be the flexibility there. And then with that, I think Representative Hicks, quick.
Yeah, super quick, Chair. I'll be super fast. I love this program. I've spoken at your conferences, and I'm happy to be a co-author with you. Whenever we can empower people to move to a less restrictive setting, and doing so is good for them, but it's also good for the taxpayers of Minnesota because it saves us money too. So I always want to throw that out there because I think sometimes we forget that these programs also have that other flip side for everybody else as well.
Okay. Thank you, Representative Hicks. Representative McDonald, very quick closing comment.
No, thank you very much for hearing the bill. You can see what it does. It trains those with developmental disabilities to go throughout the whole state and do training and to empower individuals to live a good, beautiful quality of life. So you've seen it, you testified, it was wonderful. So thank you for giving the hearing, and I look forward to having it on the House floor someday that we can vote on this.
Okay, very good. I renew Rep. Keel's motion that House File 1466 be referred to the Human Services Finance Committee. All those in favor signify by saying aye. Aye. Those opposed say nay. The motion prevails and House File 1466 is referred to the Human Services Finance Committee. Seeing no further business in front of the committee, our next meeting will be Wednesday, March 1st.
Great job.
We'll be hearing a series of bills, and then we'll also be having a continued meeting at 6 p.m. that day. Thank you all. We are adjourned.